Since it is Heart Health Month, we're going to learn about a condition that affects more than 2.7 million people in the U.S. It's called AFib, which is an abnormal heart rhythm with symptoms often described as butterflies in the chest. Dr. Timothy Woods is joining me to discuss what people living with AFib should know. Doctor, thank you so much for being with us.
Thank you for having me.
And actually, reading a little bit on AFib, I understand that people dealing with this are actually at a greater risk for stroke. Why is that?
Atrial fibrillation, essentially, or otherwise known as an irregular heart rate, puts people at a higher risk of having a stroke, up to 5 times greater risk. And the reason of that is because that irregular heart rate allows the blood in the heart and throughout the body to actually pool. And when it pools, it can develop clot. If that clot moves to the brain, it puts you at a significantly higher risk of having a stroke.
Well, and I know we're talking about a specific treatment today, correct?
Yeah, we're here to talk a little bit about atrial fibrillation, but also the need for anticoagulation therapy. Anticoagulation therapy is basically blood-thinning medicines that can hopefully prevent the heart from developing that clot. And not only that, does that medicine have the ability to be reversed in that rare event that somebody might need emergent surgery?
Well, let's talk a little bit more about that reversal agent and when that might be needed.
Most of our patients who have atrial fibrillation are going to be on an anticoagulant or a blood-thinning medicine, and that, as mentioned, prevents the clot from forming. Unfortunately, there are cases where people would need to have emergent surgery or trauma or something to that effect. I'm a trauma surgeon, and on a daily basis, we deal with those unfortunate events where people need emergent surgery. If you're on a blood thinner, you need to have that blood thinning medicine reversed to have as good of an outcome as possible. And unfortunately, not all anticoagulants have a specific reversal agent.
And is that kind of where we're at today as far as having that reversal agent for each one of those in that specific instance?
Well, right now there's only one medication that's an anticoagulant that has a reversal agent, and that medicine is called Pradaxa, and it has a specific reversal agent called Praxpine. So if you're on that medicine, I can literally give the Praxpine, and within minutes the reversal will be complete and that patient would have normal bleeding. Unfortunately, our other blood thinning medicines, we don't have that, so it can take time to reverse the blood thinning effect. Time can be life, time can be injury, and so that is one of the key things that you need to do is talk to your primary care provider and decide what blood thinning agent is right for you, and do you need to have the ability to reverse that agent if needed.
Well, doctor, I said at the very beginning of this interview, we were going to tell people that are living with AFib what they need to know. This is definitely falling underneath that category. Is there a place I can go online to even learn more?
You can always go to the CDC website to do this. You can look up atrial fibrillation or AFib online, but probably the best place to go is right to your primary doctor or your cardiologist. Look for the warning signs, have that open discussion with your primary care provider, ask the tough questions, and you really want to make sure whatever medicine you're on, it's right for you.
Doctor, thank you so much. Like you said, time is health and time is life, so thank you so much.
Thank you very much.
We'll be right back.